Hey, y'all, wanted to talk about training around pain, training through pain, or avoiding pain when you're training. Can you train through pain? There's a couple guidelines in the literature on this. The guideline is that if you're not going over 5 out of 10 pain and it's not worse the next day, then you didn't overdo it and you should be okay. But you just got to monitor and make sure that it's not getting worse over time. Can you trade through pain, especially if it's at a lower level and you're used to it? Well, yeah, there's not a lot of evidence to say this is going to for sure get worse. So you can certainly do it, especially if you're used to it. You can train through pain and then sometimes it just gets better. So you may do a few reps and then all of a sudden this pain that you had kind of just goes away. And that's fine. The other day I was doing squatting and I had a little bit of knee pain during the first reps. And then by the seventh rep, I didn't have any more pain, didn't have any pain the next day. So I was good to train. Now, in general, if you're going to train through pain, I like my patients on the lower end, like 1, 2, 3 out of 10 pain, because once it gets up to kind of 5, that's kind of the iffy zone if it's going to kind of blow up on you or not. But if you want to go see somebody like me, a sports chiropractor, then certainly you can do that to just get it checked out if it's not getting better over time. Sometimes just training around pain is how you can get out of pain. If you have pain with bench press, so you get in the bottom position, you have pain right there in the front of the shoulder. Now you can just go not as deep. In general, you want to go as deep into a stretch as you can because it tends to build more muscle mass. So you really want to get that full stretch if you can. Instead of that, you can do an incline bench or decline bench instead of having to limit range of motion. Another thing you can do that's pretty common is lower the load. We know from the literature that you can lower the load and do somewhere between 5 reps all the way up to like 35 reps. And I've seen literature saying that 40 to 60 reps can be good, but that may be enough for you to get out of pain. If you're doing that many reps though, like it's going to take forever to get through your workout. So lower the weight down until you don't have pain and then you can build up from there. What you may find is over a few weeks to a couple months that if you slowly increase the load, maybe 5 pounds each week, like on a squat, deadlift, bench press, that you'll probably get to the point where you can train without pain if you load really slowly. So you can modify that way. Or let's say if you're doing a squat and you have pain with that, you can just do a different exercise altogether. So you can do a leg press or a different form of a squat like Smith machine squats or hack squats. You could do a combination of leg extensions and hip thrusts. So you're training the same muscles. And what you may find is as you modify and you're not pushing through pain, that when you go back to that exercise, you may not have any pain whatsoever. You may find that when you get back to the exercise, it may still be painful. Another way that you can do this is if you warm up. So I would highly recommend if you're going to go heavy, that you definitely warm up beforehand, check whatever movement you're going to do, and then go lighter in that load, and then build up over a few sets to your actual working weight, and then go from there. That usually is a pretty good strategy to help to decrease pain and get things warmed up. Sometimes that's not enough. Sometimes doing things like warming up the rotator cuff, doing some external rotation with a cable machine or a band can be helpful, or strengthening the mid back muscles like a band pull apart or reverse fly, or maybe doing some foam rolling or lacrosse balling around the shoulder girdle can also turn off that pain, and you can do that bench press without pain. And some people that turns it off for the whole session. Some people, it's just going to help for maybe a set or two, and then the pain may come back. So your mileage may vary, but it could be a strategy that you use to be able to train around pain as well. So there's multiple ways to do it. Just make sure that you're getting better over time. If you're not, you can certainly go see somebody. All right, guys, bye.